Chronic wasting disease, CWD, is like a broad range of today's issues. There is a high level of complexity. When the full suite of public information is not available, an incomplete and oversimplified public narrative can result. The purpose of this infographic video is to share answers to some common questions being asked within the hunting community and invite a closer look at all the perspectives concerning CWD. Background: Alberta has historically been world-renowned for its impressive and plentiful mule deer. The first case of CWD in wild cervids in Alberta was detected in 2005 near the Saskatchewan border. In the early years of detection, total eradication of CWD was considered possible. Massive deer culls were done in the early 2000s, removing large numbers of deer from the landscape in areas along the Saskatchewan border. Experimental efforts to reduce population densities through increased hunter harvest have continued with no measurable result. Is CWD dangerous for my health? There is no evidence suggesting that CWD can infect humans. The U.S. Centers for Disease Control advise that if any human health risks exist from CWD, they are extremely low. Although it is not recommended to eat wild game until after a negative CWD result is obtained, the potential for a species jump, the disease spreading from cervids to humans or cattle, is minuscule. The Centers for Disease Control and Prevention have stated that, to date, there is no strong evidence for the occurrence of CWD in people, and it is not known if people can get infected with CWD prions. Outside of the hunting community, there is less public awareness on CWD, and the fear of a species jump can help generate public concern and sustain funding for research efforts. You may have heard of the infected primate study, which suggested that CWD was transmitted to monkeys that were fed infected meat, but that research was unpublished and has not been peer-reviewed or successfully replicated. Other studies have indicated the opposite results. How does CWD spread? The origins and transmission of CWD are not well understood. It may be the result of spontaneous occurrence, or could also be caused by interspecies transmission. Infected animals can shed CWD prions through their feces, urine, and saliva. Prions can persist in a natural environment for unknown periods of time and at low cervid population densities. This means that cervid populations could be dramatically reduced, but CWD could persist. Deer are herd animals and naturally congregate regardless of the density they are reduced to. In Alberta, CWD is centralized along the Saskatchewan border, but there are no restrictions on carcass transport or accessible means for carcass disposal at landfills. In comparison, while CWD has not been identified in any species in British Columbia, they have restricted the import of intact carcasses from other jurisdictions. Last year, I had to submit my deer head for CWD testing. What is the purpose of the testing? There are mandatory head testing requirements for some cervid species in certain areas of Alberta. Any legally taken animal can be tested if desired by the hunter. This program has been operational in Alberta in some capacity since 1996. The current program only affirms the current prevalence of CWD in locations where it is already known to exist. The head testing program has the potential to provide a source of data to better understand the age distribution of positive animals. Using tooth aging to understand the age distribution of CWD positives would be useful information. There is some promising research on natural selection of CWD-resistant deer. What is being done about CWD in Alberta? Is it working? There is no definitive strategy that slows down the spread of CWD, let alone eliminates it. There is currently no vaccine. The Western Association of Fish and Wildlife Agencies, which represents wildlife management authorities in 24 states and most Canadian provinces, suggests, in the absence of definitive CWD control strategies, it follows that a coordinated, adaptive management approach would provide a path forward for CWD management. Adaptive management would allow for strategic application and evaluation of experimental CWD suppression strategies, whereby the data gathered would then be used to develop improved strategies. This approach is not to be confused with simple trial and error. Rather, it is a systematic, hypothesis-based, and scientific approach to applied management. Experimental population reductions have been the strategy used in Alberta for 20 years. This approach has not identified clear objectives, such as indicating what the current populations are and what they will be reduced to. Population reductions are not a proven strategy for CWD containment. All mule deer in the province could be removed, but you would still have CWD, as it is also carried in whitetail, elk, and moose. To maximize scientific legitimacy, social support, and cost efficiency, and experimental design using the scientific method must be followed. A proper experiment will require controls and variables. Any data collected needs to be assessed using predetermined metrics, after which the strategy will be evaluated and, if necessary, adapted. If the needed baseline data is not available to start an experiment, resources should first be dedicated to building this foundation before attempting the experiment. The analysis should also give due consideration to the trade-offs that exist. A retired Wyoming State wildlife veterinarian once said, "After 20 years of involvement in almost every aspect of CWD, I tend to be more philosophical than scientific in my perspective of this disease. I reflect on human arrogance, which demands a solution to every problem, but knows not the consequences of the solution. I question our empathy for healthy, sentient creatures, when our only management solution seems to be a bullet. I despair at how ineffectual human intervention is once a disease takes hold in wildlife. Lastly, I wait to see a comprehensive cost-benefit analysis of current and proposed management efforts to control or eradicate CWD. It is important to understand not only the possible consequences of the disease, but also of each potential solution proposed." Conclusion. Determining the best course of action in the face of uncertainty is no easy task when the science is inconclusive and trade-offs exist between every option available. Management of all wildlife should be based on the best available science. When it comes to CWD, using a widespread population reduction through hunter-harvest is not a proven approach. You could remove every mule deer in Alberta, and CWD could still persist in the environment or other cervid species. If population density reductions continue to be attempted, they should be systematic and data-driven, designed with a larger goal of contributing meaningfully to the understanding of the disease, so that meaningful CWD strategies can be designed to provide healthy deer on the landscape for all Albertans to enjoy. If you would like to read more about CWD or the resources mentioned in this infographic video, please visit www.apos.ab.ca/CWD.